Good morning, everyone. My name is Yating. I'm a PhD student from Department of Rehabilitation Science, the Hong Kong Polytechnic University. And my topic today is 3D printed transparent face mask for children with facial hypertrophic scars. So probably for most of you, you are not quite familiar with the field I'm working on. So I'll have a brief introduction on the background of this study. So according to the report of WHO, nearly 11 million burn patients need medical interventions in 2004, and most of these burns happened in Southeast Asian region. And unlike the Caucasian population, our Asian population are very susceptible to hypertrophic scars. According to a study performed in 2005, over 70% Chinese people will develop hypertrophic scars after skin injury. And so what is hypertrophic scar? Just as shown in this picture. So hypertrophic scars are defined as the raised erythematous rigid scarring tissue, and they may cause joint contractures and deformities. They usually happen after major skin injuries such as burns and trauma. So facial hypertrophic scars after burn injury is a serious complication which can lead to facial deformation. It severely affects the physical and psychological development of the pediatric patients. So you look at these pediatric patients in these pictures, and because they have extensive facial burns, and after the wound healed, they will have facial hypertrophic scars, and it will seriously affect their quality of life, and it will affect their whole life quality. So it is important to treat this kind of patient as early as possible. And the most urgent, most important treatment strategy that we should apply as soon as the patient had this wound is the rehabilitation. So we should start the rehabilitation strategies as soon as possible to control and prevent the development of the hypertrophic scar. So pressure therapy and silicone gel are the most commonly used rehabilitation strategies for the prevention and treatment of facial hypertrophic scars. These pictures showed you the commonly and traditional ways for using the pressure therapy. This picture is a pressure garment. It is made of elastic fabric and wrapped the whole head of the patient. And this is the elastic fabric made pressure garment. And some patients will use this rigid face mask. However, there are problems associated with the use of this kind of treatment because the elastic fabrics will lose the pressure when you cut the holes for the eyes, nose, and mouth. So it will lose the treatment effect on the scars. So it will not be convenient, and also for all these face masks and pressure garment, they are not transparent. So when the patients, especially the pediatric patients, they wear this kind of pressure garment, it is difficult for them to get back to their normal life and to involved in their social activities. So this will have a very bad effect on their psychological development. And another popular and widely used method for the rehabilitation of facial hypertrophic scar is using the transparent face mask. It has been widely used since its invention in 1979, and now it has been used in most of the countries, including the US and Europe and also China. But the problem with this transparent face mask is that it is very difficult and labor force consuming to make, because the patient, we need to take the impression from the patient firstly, and then made a plaster mold according to the impression taken from the patient, showed in this picture. And after that, we'll use a transparent thermoplastic sheet to mold according to the plaster mold to finally form this transparent face mask. So through all these multiple molding steps, the accuracy of the face mask will be affected, because there are possible errors occurred during the multiple molding process. And also these steps are almost impossible for pediatric patients, because they cannot cooperate with this mold taking process, so that usually they will need general anesthesia, and which is not very convenient. And also the patient, the pediatric patient, when they are lying down, the facial contour will be different from when they are sitting. So this is not a good way, not a convenient way to perform for the pediatric patients. And also, one thing I would like to add on is that why will we need the face mask to be transparent? Because when we treat the facial hypertrophic scars, we want to apply pressure to reduce the blood circulation of the scar. So only through this transparent material, the therapist can observe the scar and can see that whether the scar are well blanched through the pressure, so that the treatment effect can be good. So why not 3D printing? As we now have 3D printing very popular, and the machines are available all over the world. So we use the 3D printing technology to produce the transparent face mask. And the process are very easy for you to understand. First, we will scan the patient with a portable 3D scanner. And then we import the scanned file to produce the face mask according to the patient's facial scans, and then print out the face mask using the transparent and biocompatible materials. Sorry. And then the face mask is produced. So, but there is also another question that we want to ask. Is this face mask good enough for every patient? In fact, we found that because our facial contour is complicated and there are different thickness of the soft tissue and the bones, the structure of the bones are different, so that even if the face mask is made completely according to the patient's face, there are some problems. So we did a finite element modeling analysis on the compression distribution on the standard patient, and we found that on areas where there are more bone tissue, there are bones underneath the skin, the face mask will generate higher pressure. And on areas where there are not a lot of soft tissues, such as the side of the cheek and side of the cheeks, there will be very less pressure. So that this gives us some clues that when we are designing the transparent 3D printed transparent face mask, we need to keep these concepts in mind, and sometimes we need to adjust the contour of the face mask a little bit, such as we will indent the areas with soft tissues and release some of the concentrated pressure on the bony areas. So this is basically the study, the first step of the study before we really apply the face mask on the patients. And next, I'll show you some of the clinical cases that we applied the 3D printed transparent face masks on the pediatric patient. Actually, we also apply this on the adult patient, but because pediatric patients are more difficult to treat, so I want to focus on this part here. So this is a 1-year-old female patient. She was burned by hot charcoal ash during a accident. So she came to our hospital and her burn wound healed after 1 month. And then we judged that she has very high potential to have facial hypertrophic scars, and so that after the burn wound healed, she quickly developed the facial, the scar quickly broke, so we need to control the facial hypertrophic scar, so that we did the 3D scanning for the patient. However, because she's only 1 year old, she cannot cooperate with the scanning because we all know that when we do 3D scanning, she has to stay still for at least like 30 seconds. But actually for these young kids, we do not need to general anesthesia. We just put her into sleep in her mother's arms and upright a little bit so that the face can be better scanned. So that we took several scans and then merged these scans together to form a whole scan of her face. And then we will flatten the areas where you see these areas already have the protruding scars. We flatten these areas on the scans, and so that when the face mask is made, there will be higher pressure on these areas. And we also designed the bolts that connected to the face mask and can be printed directly in one step. And this is how we made the face mask. And then, as I mentioned earlier, silicone gel is also a recommended treatment for the rehabilitation of the facial scars. So we lined a layer, very thin layer of silicone gel on the inside surface of the face mask and put on the patients. And we can see that these areas where she has a lot of scars has been completely blanched, so that it will have very good treatment effect. This picture shows you the patients. This is before the treatment, and this is just 1 month after treatment. And we can see the scar has flattened, and also the color of the scar has become less red. And this is, this is 3 months after treatment. We can see that the scars has become less conspicuous compared with before treatment. And this is another case, a burn patient. This is a 6-year-old boy, and he was burned by fire at home. Also, it's a household accident. And this is how his scar progressed during the treatment. This is before treatment. We can see that the scar has developed and all over his face. And after 1 month of treatment, most of the scar, especially those over the forehead, has flattened. And this is 1 year after the treatment, and most of his scar has matured, become less red. But we have to mention that the pressure therapy cannot solve everything about the hypertrophic scar. But he will not need the major reconstructive surgery, maybe just some small surgeries or laser treatment afterward. He will have a very favorable result. And the most important for this boy is that during all these years treatment, he can play with his friends and go out to join all the social daily activities as usual, and he doesn't have any sense that he was very seriously burned, that his life was completely done like that. But he's actually very happy every day when he was wearing the face mask. So I think this is the most important and precious part for this application. And for these previous two cases, we have published a paper about the application of these 3D printing transparent face masks for the treatment of these pediatric patients. And I want to mention another case. This is a 4-year-old female patient. She was also burned at home with some hot oil. And because this girl is with very strong personality, she's like loved by everybody at home, so she will reject every treatment if she's not feeling comfortable. So before this treatment, she has received the traditional treatment method, and she felt very uncomfortable, and she's resistant for all this treatment. So that we decide to design a specific and beautiful face mask for her, so that she can wear and also become beautiful, because she actually was a very beautiful girl before the accident. And so we print out a partial face mask and stick on some decorations. Actually, these are decorations we use to decorate our smartphone cases. And so that she loved this face mask very much. She wear it every day and go to school every day and play with her friends. And even her father took her to travel in another country during the summer vacation. And she has no problems to join all of her daily activities. And what's impressed me most is that his father once said to me that because of the 3D mask, she is able to go to school, continue with her usual activities, and most importantly, continue her social activities. So I think this is most important for us to apply this 3D printed transparent face mask to the pediatric patients, which can help them to regain their normal social life. So here's the conclusion of my presentation. Our newly developed 3D printed transparent face mask with silicone linings is convenient and efficient to fabricate, easy to apply on pediatric patients. It is effective in the prevention and treatment of facial hypertrophic scars after burns in pediatric patients with satisfying clinical outcomes. Successful rehabilitation of pediatric facial burns needs the cooperation of the children themselves, their families, and the whole society. The acceptance and adherence to the treatment is the key to success. Okay, thank you very much.